Hi. 4 years ago, we wanted to change something in our clinical practice. As health professionals, we know that wrist, hand, and finger pathologies are very difficult to rehabilitate and they have a high cost. So we know that exercise is key for the treatment, and most of the cases can recover with a home exercise program at home. So imagine that you are a freelance with a carpal tunnel syndrome or a worker who fell down or broke your hand. We come to the hospital and we give you this, a paper sheet with exercise. So yes, imagine that you are there with us. We remove the spleen and you see the scars of your hand after the surgery. You can see your hand, but you cannot move it or feel it at all the pain, and we expect you to do all the exercise alone at home every day. So in 4 weeks, I will see you again, and I will not have any idea about your recovery process or if you have done the exercise at all. So to solve this, we have created ReHand. It is a tool for us to prescribe home exercise program to our patients. So now the patient doesn't receive this anymore, a paper sheet with exercise. We give the patient a code to access the app. So the patient download the app and access to find a home exercise program totally individualized for them. So this is an example for the pinch exercise. So the first thing that the app asks to you is to calibrate in order to know your status today. So here we put the initial position and the size of my hand, and then the app asks me to please tell me the range of motion without pain. So open the pinch as far as you can without pain. So with this, we take the range of motion without pain of the patient. So the app adapt to the status of the patient, and then the patient can follow the exercise. So of course, if the patient do something wrong, the screen becomes red and the app guide the patients. So another great point for me as a clinician is the scales. So normally we give patients in the hospital scales or scientific questionnaires to allow us to objectify how the pathology impact in the patient's work or daily activities. So now we can send this scale to the app, so the patient is at home and can answer the scale directly on the tablet, and these results will arrive to my email directly. So basically, we receive an email every week with all the info in order to know if the patient is doing or not the exercise, if the patient is doing right or wrong the exercise, and with the results of the scale. So with this info, I can decide to keep my patient working at home, or I can tell my patient to come back to the hospital because there is some sign of complication that we need to see. So, well, this is what we have developed. This is a tool for us as clinicians. During the last 10 years, the way that we do surgery and rehabilitate these kind of pathologies has changed a lot, and we have put the last scientific evidence in our technology. So ReHand is an evidence-based tool, and we have conducted multi-center control trials in 6 hospitals with more than 600 patients. So the results of the trials has been really impressive, even for us. So the results have showed that this approach shortens the recovery process. So this helps the patients and also help the health insurance to generate savings. So now, after these results of these trials, we are helping patients and our colleagues to achieve better health results, and also to help hospitals and health insurance company to generate savings. So that is what we do. Thank you for having me.